Quinixil 0.1% to 5% topical cream corticosteroids is a medication used to treat skin conditions such as eczema, psoriasis, allergies, and rash. It helps decrease swelling, itching, and redness. This medication comes in different forms like cream, ointment, and lotion. Your doctor will choose the best type of product based on the skin condition and the area of the body being treated. It is important to use this medication as directed by your doctor in order to get the best results. The daily dosage will depend on the severity of your condition, so it's important to follow your doctor's instructions. It is typically recommended to apply the cream once or twice a day, and the best time to apply it is usually after bathing or showering. Remember to wash your hands before and after applying the cream, and avoid using it on the face, underarms, or groin area unless directed by your doctor. Before you start using this medication, make sure to read the patient information leaflet provided by your pharmacist. This medication is meant to be used only on certain areas of the skin, so do not use it on the face, groin, or underarms, unless your doctor tells you to. Before applying the cream, remember to wash and dry your hands, then clean and dry the affected area. Apply a thin film of the medication to the affected area as directed by your doctor, usually once daily. Gently rub it in, and do not cover the area with bandages unless your doctor tells you to. After applying the cream, do not wash it off immediately. However, make sure to wash your hands with soap and water after each use, unless you are using the medication to treat your hands. Be careful to avoid getting the cream in your eyes, nose, or mouth. If this happens, rinse thoroughly with water and contact your doctor if irritation persists. For the best results, use this medication regularly at the same time each day. Do not use more than prescribed, as it will not improve your condition any faster and may increase your risk of side effects. If your condition does not improve after 2 weeks of treatment, or if it worsens, be sure to inform your doctor. When using Quinixil 0.1% to 5% topical cream corticosteroids, you may experience burning, itching, or stinging, but these effects usually only last for a short time. If they persist or worsen, it's important to inform your doctor or pharmacist. It's vital to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. While many people using this medication do not experience serious side effects, it's important to be aware of potential issues. If you notice any serious side effects such as stretch marks, skin thinning/discoloration, acne, or small red bumps on the skin, folliculitis, it's crucial to inform your doctor immediately. In rare cases, the medication may be absorbed into the bloodstream, leading to potential side effects of excessive corticosteroid. This is more likely in children and in those who use the medication for an extended period or over large areas of the skin. If you experience unusual or extreme tiredness, weight loss, headache, swelling ankles/feet, increased thirst/urination, or vision problems, it's important to seek medical attention. While very serious allergic reactions to this medication are rare, it's important to seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects, so if you notice any other issues, it's crucial to contact your doctor or pharmacist. And as always, if you experience any side effects, it's important to seek medical advice. Before using Quinixil 0.1% to 5% topical cream corticosteroids, it's important to let your doctor or pharmacist know if you have any allergies or if you are allergic to any of the ingredients in the product. This is because some inactive ingredients can cause allergic reactions or other problems. You should also inform your doctor or pharmacist about your medical history, especially if you have poor blood circulation, diabetes, or immune system problems. It's important to note that corticosteroids can make skin infections worse and more difficult to treat. If you have a skin infection, make sure to inform your doctor so it can be treated properly. Also, if your condition does not improve or if you experience worsening skin symptoms, it's important to notify your doctor. Using corticosteroid medications for a long time or over large areas of skin may make it more difficult for your body to respond to physical stress. Before any surgery, emergency treatment, or if you experience a serious illness or injury, make sure to inform your doctor or dentist that you are using this medication or have used it within the past few months. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. There is a possibility that this medication may temporarily slow down a child's growth if used for a long time, so it's important to have your child's height checked regularly by a doctor. If you are pregnant, Quinixil 0.1% to 5% topical cream corticosteroids should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. When using Quinixil topical cream corticosteroids, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. This is why it's important to keep a list of all the products you use, including prescription and non-prescription drugs as well as herbal products, and share it with your doctor and pharmacist. It's crucial to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Quinixil 0.1% to 5% topical cream corticosteroids. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center. It's crucial to seek help as soon as possible in case of an overdose. It's important to remember not to share this medication with others. This cream has been prescribed specifically for your current condition, so it's not recommended to use it for other skin problems unless instructed by your doctor. In those cases, a different medication may be necessary. Your doctor may also conduct lab or medical tests, like checking your adrenal gland function, while you are using this medication. This is especially important if you use the cream for a long period of time or apply it over large areas of the body. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to use a dose, use it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and use your next dose at the usual time. Don't take a double dose to make up for the missed one. Make sure to store this medication at room temperature and keep it out of reach of children and pets. Do not throw it in the toilet or drain unless directed to do so. When it's expired or no longer needed, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.